Lactate is one of the most important things that you need to be familiar with if you want to work in the ED. Lactate is the product of non-respiratory energy production. As we know, our bodies get energy by burning glucose and some proteins and fat. And the way that it burns these products is using oxygen. But if it doesn't have oxygen, it will go to a pathway that does not rely on oxygen. And this other pathway produces a lot of lactate. So when you see high lactate levels in some patient, you would know that this patient has some issues or some tissue injury that causes less oxygenation of certain tissues. So high lactate means low oxygen. And this doesn't have to be systematic or throughout the entire body. If, for example, a patient has mesenteric ischemia, which affects a small part of the bowel, it can increase lactate levels very quickly. So even small amount of tissues can produce a lot of lactate, which makes lactate sensitive but not specific. Another important thing to note is that lactate itself is called lactic acid, so it's acidic. And high levels will quickly cause acidemia. And when you have acidemia, the brain and the nerves will be affected, and the patient will have neurological symptoms, including confusion and sometimes coma or seizures. The normal levels differ between venous and arterial blood. Venous blood ranges from 0.5 till 2.2, and arterial blood ranges from 0.5 till 1.6. If the levels are high, ranging from 2.2 till 4, it indicates mild hypoxemia or some increase in the anaerobic metabolism. If it's higher than this, reaching 6, it can indicate some severe stress caused by sepsis or significant hypoxemia. And at this point, you need to start having pH levels and to monitor for metabolic acidosis. And if it's too high, above 6, it indicates severe shock or severe metabolic issues. And these patients have a higher chance of morbidity and mortality. This lecture is part of the emergency medicine course. If you find it useful, you can check out the entire course in the link in the description. The course covers everything that has to do with the emergency department, including tests, imaging studies, common cases, and serious conditions. We also have a lot of cases and quizzes that you can take to test your knowledge. Just check the link in the description.